Okay, so I am going to discuss the epidemic that is the opiate crisis on heroin. So, heroin is a big issue right now, especially since they are cracking down on prescription pain medication, hydrocodone, Lortab. So, patients are trying to get their hands on whatever they can get for pain control. So, one of the articles that I read was from Drug Control and Policy, the heroin on epidemic. According to the official Office of Drug Control Policy for Kentucky, it says that more than over 1,000 people a year in just the state of Kentucky dies from overdose of drugs like heroin and fentanyl and prescription drugs. So, what exactly is heroin? So, some nicknames can be black tar, big H dog, horse, and puppy chow. It's a highly addictive drug. It's derived from morphine, so it's very addictive. It can be injected, smoked, inhaled, or even snorted. It's also dangerous because there's no way to know exactly how much you can get. So one time you may get a different amount, and then that's why people overdose, because they don't know exactly what they're getting. It's easier to obtain than evidently prescription drugs lately. For example, I know of a case when I was working in the hospital. We had a patient who the doctors didn't believe that he was in pain. So he decided that heroin was a better alternatives because he was able to obtain the heroin. So he was put in the hospital for osteomyelitis because he kept injecting heroin. So while the patient was in the hospital, he had family members come and visit him, and they were so afraid that he was going to withdraw from heroin that they decided to sneak some in, and he injected it into his IV port. So, and then of course the whole process started over again with him withdrawing. So finally, once he got over that bump and knew that there was better alternatives to help with this, then he was able to conform to just, at least during his hospital stay. Also, it affects nursing. I work in an endoscopy, and so therefore we are doing procedures. So when patients come in and they do drugs and pain medication, the more pain medication they're on, and recreational drugs, it is very hard to sedate them without putting them more at risk for respiratory distress or respiratory failure. A lot of times, some patients who have a history of narcotic abuse, opiates, they usually take more medication to sedate. So therefore, it's harder on them to recover, as well as to get back to baseline, and especially just to keep them sedated during the procedure. I mean, there's so many times that patients wake up during a procedure, and then procedures are put on hold, or we have to stop in the middle of it and give this patient more medication, and then their heart rate drops, and then their O2 sats drop. So heroin and just any other kind of pain medication on a chronic basis has been definitely a day-to-day issue in my line of work. So, and also I was reading the article, and it said that most people, the ages that it really affects heroin overdose is ages 32 to 44, which I found very interesting. And I can see that a lot of people turn to alternative medications. Unfortunately, is not the good alternative, which leads me into my alternative opioid medication of choice. So this is why I chose to do essential oils. This is my handout for essential oils. I chose to do it as an alternative, as a non-opioid pain management, because I use the essential oils in my daily life. So I have some post-traumatic arthritis in my ankles and my feet, and I use some of the essential oils on a daily basis because I don't want to take pain medication, and I wouldn't be able to take care of my patients if I was on drugs all day. So this is a better alternative for me, and plus they smell good, so it's kind of like a bonus. So, so anybody can use essential oils. So, who is the target audience? Anybody from the age of 2 to 102. So the only reason why they don't want to use it on smaller kids is because it can create more respiratory problems if if other things haven't really developed yet. So my target audience is anybody who is in pain, discomfort, chronic pain, arthritis, headaches, muscle soreness, menstrual cramps, joint pain, any chronic or acute pain. A lot of floor patients we use, especially on some of the lavender, as well as it not only helps with pain management, especially for like back pain and neck pain, but at the end of the day, after they get a bath or whatever, you put it in some lotion, rub it on their back, they get a nice little back massage, and it's very soothing and calming, and it also helps with the pain. So it's kind of like a two-part that helps. It helps them relax and calm, and so it really is good. Let's see what else. So my goals and outcomes for this is at the end of my presentation, my patient will be able to show me how to apply the essential oil topically to the area of pain and how to use it for inhalation. So essentially at the end of this, my patient will have less pain and have more pain control with essential oils. So what are my learning objectives and my learning domains? Okay, so for my learning objectives and domain, I chose to do so for my cognitive, my patient will demonstrate how to correctly apply the essential oils to the area. For the affective domain, the patient will verify what the essential oils are used for each one. And then the psychomotor, patients will be able to practice using the essential oils by rubbing it on the affected area. So my evaluation is, at the end, my patient, I will observe my patient correctly applying the essential oils to the affected areas. For the affective, my patient will verbalize what the essential oils are used for each different ones, especially just certain ones that they like smell-wise or whatever the scents that they would prefer to use. And then psychomotor, I will observe my patient applying the essential oils to the affected area. Okay, this is my handout. So, of course, there's some white space. The things that I do want people to notice are in big black letters. Some oils for the alternative pain relief. I do have some samples here. So lavender is probably one of my favorite. I use it most of all. I love the smell of it, and it really seems to help. Another good one is ginger. So I use ginger when I need to, and it has a good smell as well, but lavender is my favorite. Another one is peppermint. So peppermint has many, many different, not only just for pain control, you can also use it for several different things. It's for arthritis, headaches. Also, it helps with nausea and vomiting, or upset stomachs. You can smell it, and it does really well. Another one is lemongrass. So I love the smell of lemongrass. It's very calming, as well as it works really well for arthritis as well. So I also brought some of the things that how you can apply it is 1 to 2 drops with either your lotion that you normally use, so you're not going to be affected, have an allergic reaction if there's a lotion that you already use. Another one is grapeseed oil. If you like more of like a massage oil, so you just put 1 or 2 drops with the oil, rub it into your hands, and then just rub it to the affected area. And then, of course, for inhalations, if you just want to smell for like nausea or whatever, you can put a couple drops on a cotton ball and, you know, sniff it, and it smells really good. Have it at hand. You can just throughout the day. So some contraindications. However, I would not use it on cardiac. If anybody has any cardiac problems, specifically peppermint, you do not want to use the peppermint on any cardiac patients. Also, pregnant women or children less than 2 years old, you don't want to use it on. And also, they highly suggest don't ingest the oils, you know, smell them or rub it on. It does really well. However, some essential oils, they say, has a shelf life of 6 months. So just kind of keep cautious. You know, I use the little bottles, so therefore, if I don't use it all, I'm not going to waste as much. Avoid any inhalation applications if you have any asthma or any breathing problems. You definitely don't want to aggravate that or do anything to make it worse. So, I hope you enjoyed my presentation, and hopefully that you would try to do essential oils in place of alternatives for non-opiate pain medication. Thank you.